May is also Arthritis Awareness Month. It's estimated by the year 2030, 67 million Americans, that's 1 in 4 adults, will be affected by arthritis. Right now, arthritis affects 50 million U.S. adults, most of whom are 65 or younger. It costs $128 billion per year in health care and continues to be the most common cause of disability in the United States. This year's Arthritis Foundation theme, Take Action, is aimed at raising public awareness of proactive steps like physical activity, which can improve arthritis symptoms and your quality of life. Dr. Samir Guru, one of the specialists at Florida Hospital Waterman's Joint Replacement Center, spoke with us about the impact arthritis can have on our joints.
Pain would be the first indicator. And then as it progresses, you can get a deformity in the leg based on the extent of the arthritis or where the arthritis is. You can get a varus deformity where the knee starts to bend in or bow in. I'm sure you've seen people that are walking bow-legged or knock-kneed, and those are all based on what side the arthritis developed, and the deformity can result in you looking bow-legged or knock-kneed. There's certainly a genetic predisposition to arthritis. It doesn't necessarily mean that if your parents had it that you're going to get it, but we do see it run in families. Now, will it skip a generation? That's a possibility, but we have seen certain families that are more affected than others. In terms of the osteoarthritis, I think that there's no real prevalence, whether it's male or female. Now, certainly rheumatoid arthritis, there seem to be more women affected than males. There's other conditions that cause joint destruction. Other than osteoarthritis, which is the wear and tear type arthritis, there's rheumatoid arthritis, which is an inflammatory condition which affects the joints. There's what we call post-traumatic arthritis, if you have had an injury to a joint or a fracture, and then that predisposes you to developing arthritis. There's avascular necrosis, which is the blood supply to the joint that gets disrupted, and then the cartilage and the bone starts to collapse. So those are a few of the conditions that can cause you to need a joint replacement. Well, we have an excellent joint replacement program here. There's 4 orthopedic surgeons here on staff that all perform joint replacements, and we're in the process of implementing a specific program that's going to be educational for patients preoperatively as well as postoperatively. Initially, they can come in and get their pre-op education before they have their surgery, which sort of sets them up for their recovery process. Well, it helps them understand what's going on. A lot of times we're afraid of having surgery or afraid of what's going to happen to us. So this sort of educates them on what's going to happen, and it helps relieve some of their anxieties about the process.
You'll find links to more information on arthritis as well as contact information for Florida Hospital Waterman's Joint Replacement Center when you click this Arthritis Awareness story icon at yourhometownhealth.com.